Hello, the month of January is Thyroid Awareness Month. Although we should be aware of this hypothyroid or hyperthyroid disease all throughout the year. Let me discuss in short about what are the common thyroid disorders. Now, thyroid is a gland, and the diseases commonly are whether it is secreting less of thyroid hormones or more of thyroid hormones. Now, hypothyroidism or less of thyroid hormone secretion is far more common, and it is highly prevalent among Indian women. So you will find a number of women, or sometimes rarely men, who come to us for some other disorders, and during screening they are diagnosed with hypothyroid. The treatment is very simple, and of course the patient has to take a replacement therapy for that. Hyperthyroid is a different segment, and that requires an elaborate discussion. But again, if it is diagnosed, there are multiple modes of therapy for that, depending upon the cause of hypothyroidism. Now, hypothyroidism treatment has to be done by a specialist, because there are several criteria of what dose is to be given to the patient, and if at all, therapy has to be initiated for the patient. Hypothyroidism in pregnancy, hypothyroidism in adolescent and in childhood requires separate attention, and there are separate dosage guidelines for those special populations as well. Hypothyroidism in elderly also is a separate entity, and it has to be treated in a different way as per guidelines. But the message is, if you are diagnosed with any kind of thyroid disorder, especially hypo or hyperthyroidism, I'm not discussing about the cancers now, please take help of the specialists and get yourself treated, and of course maintain a healthy lifestyle. One of the major confusions among the patients is what food to take and what food we should be avoiding. Now, if the patient is hypothyroid and is on a replacement therapy, there is a general notion that you have to avoid this or that. That is absolutely wrong. If the patient is taking replacement, the patient can consume all the foodstuffs. Patients who are hypothyroid are generally obese, and that needs to be taken care of, but it's not a thumb rule that every hypothyroid patient has to be obese. So my message is, this is a very common disorder in our society, and every patient who is being treated for some other cause, I request everyone to get screened for any thyroid disorder.